Hi, my name is Cynthia Frank, and I am the co-founder and co-president of the Gaucher Community Alliance. And I wanted to give a little bit of background on our organization since we're fairly new and excited to be part of the Gaucher community. The Gaucher Community Alliance was started to just help fill some of those unmet needs in the patient community. The organization is for all types of Gaucher disease, types 1, 2, and 3, and we support patients and their families through peer-to-peer support and education, resources, and networking. We have a board of directors. We have about 13 members now, and our board of directors represents all types of Gaucher disease, and we represent geographically most of North America. So we try to really represent a wide area so that we can have the best resources to reach out to local people. And our board also has a very varied professional background so that we have access to a lot of good information that way. We also have a professional advisory council, and this advisory council was set up so that we could really have a good, strong background of that patient advocacy triangle, which includes, of course, the patients and the patient organizations, the medical and Gaucher experts, and also industry. So that way we can really open the lines of communication, find out what those unmet needs are, and continue to provide for the patient community. My disclosures. So the Gaucher Community Alliance receives grants from AVROBio, Prevail, Sanofi, Genzyme, and Takeda. And personally, I am also a member of the Speakers Bureau for Sanofi Genzyme, and I am a patient advisor to Capcell Biologics and Blue Turtle Bio, both startup organizations that are researching for treatments for both Gaucher disease and Fabry disease. I'm hoping by the end of this presentation that you'll be able to understand the different types of patient communication during a crisis and why they are important for the patient community. 2, to recognize additional patient and patient organization needs in addition to receiving treatment. And 3, we're hoping that you can recommend to us the best ways you can communicate with the Gaucher Community Alliance so that information is dispersed quickly and accurately to patients and caregivers. This world pandemic, this crisis has really, I think, thrown a wrench in a lot of Gaucher patients. And there's been a lot of fear and uncertainty. And we found that one of the most important things is to communicate with patients as quickly as we possibly can, with as much information as we can. So we've been able to do that through a lot of different ways. And I think that in these frightening times, when there is so much uncertainty in the community, people are just looking for information, and we want to make sure that it's true and reliable information and not information that's floating around that may not pertain to them. So the first way we did that is through webinars. And we, pretty early on in early March, we had a webinar with Dr. Aslam Gaucher Alpan and with her husband, Oral Alpan. And they were able to give a really good background on what coronavirus is, what COVID-19 is, and how it might affect the Gaucher population and how it does affect human patients. It was incredibly well received. There was excellent information in that webinar, and I think it very initially put some, a little bit of calmness to the patients because there was so much uncertainty. We've also been able to send out many email blasts, so any information that's new and relevant, we're able to send that out to our network of about 500 patients. We also have a newsletter that we've been using to put out information. And although the newsletter is more about building community, we did also provide information and access to our website, which hosts a lot of up-to-date and current information and resources for coronavirus. We have a listserv, which has been around forever, since the early 90s, but there's about 400 people on this, and it's just been a brilliant way to get information out to patients and really create dialogue between patients so that there's better understanding all around. And then there's also social media, which we have, of course, a Facebook page. We also, the patients put together many, many years ago, I think 13 years ago, a closed Gaucher disease group on Facebook. And it's reserved mostly for patients. I think a few others slip in, but I'm one of the administrators. And we try to keep it just a safe haven for a way for patients to communicate with one another. And there's also a closed group for types 2 and 3 disease. And I think one of the best ways to communicate is just one-on-one. We really try hard to be available to patients. Over the years, I've met hundreds of people in this Gaucher community, and I've really made an effort to reach out to those who I feel might be most vulnerable and need the most information. A second way we found that's been very important during this crisis is to communicate with the Gaucher experts and with industry. A lot of times it's these two that are the source of important information that we have to send out to the patient community. So we've regularly been conferring with medical experts and with industry professionals so that we can get true and reliable information and quickly relate it to the patient community. There is a Gaucher working group that's been put together, and we've been able to participate in those calls every other week. This is done through Dr. Ellen Sidransky at the National Institutes of Health. And it's just been an incredibly important way for us to learn what's going on and to be able to relay that information to the patient community. And we appreciate this type of information and communication so much. So that way we've been able to send out medical recommendations to patients. We cannot make those, but we can relay that information and also recommend patients to contact their doctors if they have specific questions. We've been able to learn about drug access and availability and put that out to the patient community, treatment guidelines. A lot of people lost their jobs during this crisis, which means that their health insurance can dry up. So we've been able to get financial resource information out there, both through the National Gaucher Foundation and through the drug companies. And there's just been other critical information along the way that we find that it's really important to put out there. And of course, the CDC and NORD guidelines have proven to be incredibly helpful, and we constantly cite those sources and provide links to those sources when we're sending out information. And like I said, again, this access to resources and reliable information is huge during a time like this. A lot of patients, they didn't know whether to get their infusions, to go to an infusion center and leave the house. They were afraid to have a nurse come into their house if they weren't wearing a mask or gloves. A lot of patients, we learned, were skipping their infusions. And a lot of these patients were the people who are older who they may be at risk in addition to Gaucher disease. So we had to find very quick ways how to help them and encourage them to do really what was right and what their doctors recommend. And we also understand that information changes day to day during a crisis like this, and what might be reliable information today may not necessarily be the right thing to put out tomorrow. So we've had to react very quickly and have just really constant ongoing communication with new and updated information and resources. And we also were able to send, which we're still in the process of doing now, Gaucher safety boxes. And these are boxes that we've put together that have gloves, masks, hand sanitizer, and a very important document that was put together by the medical experts, a workbook that patients can have with all their resources for Gaucher disease and COVID-19. And we also included a little seed pot because we really believe that everything we do, especially in time like this, has to be empowering and have a positive bend to it so that we can empower patients. And the response to these has been overwhelmingly positive, and people are just appreciating knowing that they have one more place that they can get something that makes them feel safe. We've also had to kind of quash some fake news that gets out there, and sometimes with something like social media and Facebook, the wrong thing can spread pretty quickly. So both Viva Rosenberg and I, the two founders of the GCA, our board, and some other volunteers are really online in these social media forums to help get the right information out there, and always refer to medical experts. And then again, of course, we refer to the CDC and NORD, which especially the CDC, that's just information we constantly put out there for patients to follow. Another thing we found that's super important is for patients to connect and communicate with each other. And that's really what our organization is all about. We're a peer-to-peer organization connecting people together so that we can all help one another. And I think during a time like this, the mental health upkeep is hugely important. Many patients are scared and isolated, and they need that connection, and they can't leave the house to get it. So we've been able to provide some resources that will help them not feel as isolated and really help them feel empowered. So we've been able to have some online sessions, and we call them Gaucher chats. And we provide, it's a Zoom conference, and we allow about 10 to 12 participants. And it's structured so that each participant can introduce themselves and speak. And the topics can really be on anything. Sometimes it's very much just on coronavirus. Sometimes it's just a forum for people to laugh a little and talk about the movies they like. At the end of this, we share the email addresses with one another. We, of course, get permission to do this, and we share so that the patients can keep in touch with one another and still feel connected that way. We also have seen that both children and older teens tend to open up more when they're with their own peers. So we've provided some sessions for younger children and also for some older teens where they can talk in their own forum. And it's open to patients. They can participate in one session or many. Some are on every single session, and some do it once or twice. And really, that's up to them and how they need to feel most connected. The last thing we also felt that is hugely important for the patient community is that we need to listen to them and respond as quickly as we can to what their needs are. Patients and caregivers, they need to have a voice and be heard. This empowers patients, and it helps them to be better advocates and to feel less victimized. So we've listened to many patients, and we tried, of course, they all have varied requests and varied needs, and we've really tried to listen and respond individually in the best we can. We also provide a lot of forums for feedback so that we can constantly learn and improve and really provide the services that patients need and that helps them most. So after webinars, we send out a survey, an email blast. We always have a paragraph asking people to reach out, tell us what they need. We do this also on social media. And again, that individual connection is huge. So, we've hundreds of emails. We've been one-on-one with people, sending information and being able to really give them the information they need. And also via the website, we have many places on the website where you can send an email and get connected and get on our list to receive our newsletters and our email blasts. And then finally, we have to consider a second wave. Things are opening up. I'm a little baffled by it all, but cities and counties are opening up and people are going out and not everyone is wearing a mask. And there is not a vaccine yet. So we need to really actively discuss the possibilities of a second wave and what might happen that second time around, what could be the same, what could be different. I think by employing all that we've done to date, we may have to do a lot of that again. And a lot of it, of course, is ongoing. But we have to do our best to really be readily available to the patient community. And that, of course, entails what I just covered. And that's, of course, communicating with patients and communicating with the Gaucher experts in industry and being able to take that communication and putting it into resources and reliable information that we give back out to the patient community. And the patients, we're going to continue to provide a forum for them to connect and communicate and ask questions and let us know what their needs are. And we have to respond as quickly as we can.